You've heard of the situation where an older adult starts to experience depressive symptoms. They become withdrawn, their mood starts to change, they become more tearful, more sad, more nostalgic, maybe experiencing despair, and the family is out of sorts. They don't know what to do. They wonder, is this normal? Is this not normal? Will my loved one even benefit from mental health care? We don't know what to do. I'm Dr. Regina Koepp. I'm a board-certified clinical psychologist, and I specialize with older adults. And in this video, I'm going to share why it is so important that you work with a mental health provider who specializes with older adults, or at minimum, has some specific training related to older adults. 1. They'll know what's typical with aging and not typical with aging, so that when they see something that is not typical with aging, they can point you in the right direction. 2, they'll have a better understanding of how stigma and stereotypes about the aging process and engaging in mental health care in general can impact the physical and mental health of older adults, so they can start to reshape it. 3, they'll be more likely to know evidence-based mental health care treatments for older adults and caregivers. 4, they'll have a better understanding of why it's so important to manage the mental health of people living with dementia. And they'll help people living with dementia maintain health, wellness, and a sense of purpose. They'll also be more skilled at managing the complex mental health, medical, pharmacological, family needs of older adults. And speaking of family, may be more likely to include family and family therapy as part of their work with adults and older families. And finally, they'll have a better sense of the community resources available to older adults and their families and how to use them. So there are several reasons why it's important, if you're concerned about mental health needs of your older loved ones or your older clients, that you connect them with professionals who specialize with older adults, or at least have some training in working with older adults. If you'd like training in working with older adults, get some information down below. We have plenty of continuing education programs for licensed mental health professionals that could really elevate your practice. And if you're looking for a mental health provider, check out our national provider directory of professionals who specialize with older adults. All right, check out resources down below.